How you doing? I'm Dr. Robert Kustarz, and we met last week whenever you came in for your physical exam, and I want to thank you for coming in for your report of findings, which is what I believe is the most important visit you'll ever have at a chiropractic office. So we're just going to go over what we found and talked about during your physical and your case history. I see you originally came in for radiant pain down your legs, and it went down both of them. So we started going through your case history, and we found that there's a car accident 3 years ago that you were in, and we found evidence of that upon palpation and upon your x-rays, which we'll get to in a little bit, which could be causing the nerve interference, causing the radiating pain down your legs. And upon your physical examination, I did a few orthopedic tests on you, and you're positive for the Eli, heel of the buttock, and O'Donoghue's of the cervical. So we're just going through that. We've definitely found where there could possibly be a subluxation in your neck and why there is pain in your low back. And on your physical, during the palpation, we found you have a lot of tight musculature in your upper cervical region, which is just the top of your spine, and reduced range of motion also in your cervical and lumbars, which is just saying that you have some tight musculature. You might have some scar tissue building up, which is causing that to happen. But upon palpation, I found in C1 and C2, which is the top of your spine, basically where your skull sits, I found tight musculature, and same thing down at L5, which is base of your spine before it meets up with your sacrum. And under compensations, since your head's kind of tilted, your body's rotating with it, so that's something we'd like to take care of. Your range of motion, just very simply, you can look further to the right than you could to the left. You can bend your head a little bit more to the left than you could to your right. And the same thing with your lumbar spine. Your just side flexion, lateral flexion, just slightly decreased. It's nothing to really worry about. We can definitely take care of that in this office. And down at L5 and up here at C1, there's something we call vertebral subluxation complex, which just means that the bone is putting pressure on the nerve, which is causing interference. It's not letting the proper mental impulses flow from the brain to the rest of the body. And just so you can kind of understand what I'm talking about, it's the same as like the weight of 2 quarters sitting on your hand. That's enough to cause nerve interference. So when I say the bone in the top of your spine putting pressure on the cord, that's all I'm talking about. It's just a little bit of pressure just causing interference. And under under the muscle area, I found tight intertransversory muscles in your upper cervical spine. So those are the muscles just holding your spine in place on the sides. And tight intertransversory muscles means it's basically trying to pull the affected side back into normal. And we found tight paraspinal muscles, which is just at the base of your spine, which keeps you upright. And weak gluteal muscles, and that's very common for someone that is having problems with their 5th lumbar, lowest lumbar. And while looking over your x-rays, I didn't see anything that falls under serious, severe, or extreme. All your vertebrae and your vertebral discs look normal. There's some decreased disc space, but all in all, your spine is in good health. And on your x-rays, which is what we're about to go over, I took a series taking an open mouth view to see how your atlas is sitting on the rest of your spine. I took a lateral cervical just to see the integrity of the spine, to see what the curve looks like. And on your cervical, we found you're in phase 1, subluxation degeneration, which just means there's misalignment and malfunction without major tissue degeneration, and that can be taken care of in this office. And we took on your hip and pelvis and lower lumbar x-rays, it shows near normal, so you're not even in a phase of subluxation degeneration. Everything looks good down there. There's just a slight rotation right there, which we can take care of. It might actually get better with just taking care of your upper cervical spine. So after presenting all this information to you, I'm going to give you my recommendations for care. Is that okay?
Yep.
So initially I want to see you come in 3 times per week for 3 weeks, followed by 2 times a week for 4 weeks, then 1 time a week for 3 weeks. And after that 10-week segment, I want to bring you in for a re-physical just to see how much progress has been made. Is that okay with you?
Sounds great.
Good. So on the back, it's just going to explain what I did today. It's going to tell you basically what you're going to need to do moving forward to help you with your care. Is this something you sound interested in?
Sounds wonderful.
Awesome. See you next week.
Sounds great.